Hello, and welcome to the RxConnect Podcast. This podcast is brought to you by the pharmacy operations at the American Oncology Network. I am your host, Melody Chang, Vice President of Pharmacy Operations at AON. Today, we are going to talk about a really important topic, healthcare disparities in oncology. We all know that cancer care has come a long way with groundbreaking treatments improving patient outcomes. But the reality is, not everyone has equal access to these advancements. So, in this episode, we're going to break it down. What do these disparities look like? What's causing them? And most importantly, what can pharmacists and providers do to close these gaps? Let's get started. First, let's talk about what we are actually mean when we say healthcare disparities in oncology. Simply put, these are differences in cancer risk, diagnosis, treatment, and survival rates among different groups of people. And unfortunately, these disparities tend to hit marginalized communities the hardest, especially racial and ethnic minorities, low income individuals, and rural residents. Here are some real examples of how this plays out. 1. Screening and early detection gaps. Some groups face major barriers to getting routine cancer screenings, which means they are more likely to be diagnosed later when the cancer is harder to treat. Second, differences in treatment. Studies show that racial and ethnic minorities are less likely to receive guideline recommended treatments like surgery or chemo. Third, higher mortality rates. Certain cancers, like breast and prostate cancer, have higher mortality rates in Black Americans compared to other populations. 4. Underrepresentation in clinical trials. Minority patients often don't get the opportunity to participate in oncology clinical trials, which affects the relevance and applicability of research findings. Now, there are a lot of reasons why these disparities exist: systematic inequities, financial barriers, even implicit bias in healthcare. But the good news is there are a lot we can do about it. Oncology pharmacists and providers are in a unique position to make a real difference. So let's talk about how. Let's start with the pharmacist. As a frontline providers, pharmacists are in a great position to help reduce disparities in cancer care. Here are some key examples. 1. Making medication more accessible. Cancer medications can be expensive, and many patients struggle to afford them. Pharmacists can help patients navigate financial assistance programs such as copay cards and patient assistance programs, so they don't have to skip doses or delay treatment. We can also advocate for cost effective alternatives like generics and biosimilars to keep treatment affordable. 2. Providing better patient education. Not every patient walks away from a doctor's visit understanding their treatment plan. Pharmacists can bridge the gap by providing culturally tailored education and using teach back methods to confirm understanding. We can also help bust common myths and misconceptions about cancer treatments, which is especially important in diverse patient populations. Number 3, encouraging clinical trial participation. Many patients aren't even aware that the clinical trials could be an option for them. Pharmacists can educate patients on why trials matter and help remove common barriers like transportation or childcare concerns. We can also work with researchers to push for more inclusive trial designs. 4. Recognizing and addressing implicit bias. Let's be honest, bias exists in healthcare, sometimes in ways we don't even realize. Pharmacists can participate in implicit bias training to ensure every patient gets the same level of care and attention, regardless of their background. At the end of the day, pharmacists are more than just medication experts. We're advocates. And by taking these extra steps, we can play a huge role in making cancer care more equitable. Now, let's shift gears and talk about oncology providers, doctors, nurses, and patient navigators, because they also play a huge role in closing these gaps. Here are some key ways they can make an impact. 1. Improving access to screening and early detection. One of the biggest challenges is getting people screened early. Providers can implement community based screening programs to reach underserved populations. They can also push for policies that expand access to preventative care like Medicaid expansion. Second, ensuring equitable treatment. Standardized treatment protocols can help reduce disparities and ensure all patients receive the best possible care. Providers can also participate in cultural competency training to better understand the specific challenges their patients face. 3. Using patient navigation services. Some patients need extra help navigating the healthcare system, whether it's dealing with insurance, transportation, or food insecurity. Patient navigators can be a game changer by connecting them to resources and the support groups. 4. Advocating for policy changes. Beyond individual patient care, providers can use their voices to push for larger policy changes, things like expanding Medicaid, improving insurance coverage, and addressing social determinants of health. When providers and pharmacists work together to tackle these challenges, we can make a real differences in the lives of our patients. So, what can we do moving forward to ensure that disparities in cancer care continue to shrink? Here are a few key strategies. 1. Stay informed. Research is constantly evolving, and staying up to date on best practices is crucial. If you are a leader, make sure your team is educated on how to address disparities in patient care. Second, empower patients with education. Patients need to know their options and what resources are available to them. Culturally sensitive education is key, especially for patients with language or literacy barriers. 3. Collaborate and advocate. We need to work together, pharmacists, providers, community organizations, policymakers, to address the bigger picture of the healthcare disparities. If you see policies that could help improve equity in care, don't be afraid to advocate for change. 4. Leverage technology. Telehealth has been a game changer in expanding access to care. especially for rural communities. Data tracking can also help identify where disparities exist and measure the impact of interventions. The more we stay proactive, the more we can make a real impact on closing this gap in cancer care. As we wrap up today's episode, I want to leave you with this thought. Addressing healthcare disparities isn't just the right thing to do, it's necessary. Every patient, regardless of their background, deserves this access to high quality cancer care. As a pharmacist, providers, and healthcare professionals, we have the power to make that happen. Thank you for tuning in to RS Connect. This podcast is brought to you by the pharmacy operations at the American Oncology Network. If you enjoyed this episode, be sure to subscribe and stay connected for more discussions on key topics in oncology pharmacy. See you next time.